Hi everyone, so I am here at PCA Narrow Women's Guild Dispensary, and it's such a special moment for me because my grandmother is part of this legacy. And as you can see, I'll just take you around and I'll speak to the doctors here. So as you can see, it was started in 15th 12th 2002. So we've got the pharmacy, consultation, dressing and injection room, observation room. This is really serving the community. However, because of lack of resources, the clinic is quite limited. So I'm gonna have a chat with one of the doctors who can tell us a little bit about what he does. Hi, Dr. Mwangi.
I'm fine.
So tell us a bit about the history of this place and what it means to this community.
This hospital started by the late Priscilla Mereka, and the Merekas are buried right inside the church, in the church grounds. The hospital has really assisted the community at large, because in a day we can attend to more than 50 patients, and the community is very happy because before then they used to go some many kilometers to reach the Kandara level 4 hospital, and now we are at par with them because the services we offer here are offered in the referral hospitals.
Yeah.
Our plan is to extend the facility, but finance is our problem. So,
what are the challenges that you're facing right now?
the challenges that we're facing right now is, for instance, we get patients who we can admit, but we are short of words. We don't have any words to admit patients.
Yeah.
As you can see, we lay them over that.
Do you want to take me in?
That bed, the observation room.
Yeah.
Where we give the patients drips and emergency attention. As you can see, we only have one bed. Right now, I'm from treating a student who has come here convert. Now the main challenge is we just do it for a few minutes, then we refer the patient if the case is serious. Number two, we don't have an ambulance, so we use our own means. I can leave the hospital and we are taken to the I take them to the hospital.
Yeah.
And then I live here with the CEOs and the nurses. I'm the medical doctor here, so it's one of our shortcomings here. We are brought to the hospital.
Yeah.
Deliveries, the maternity services. What we do, I just utilize what I have, but we don't have maternity.
Which is not much, guys, from what we can see.
Yeah. So what we do, we utilize what we have.
Yeah.
Then the patient rests for a few hours. We refer if the patient is really furious, or when the patient is okay, we just send him home. We go for home visits, which is a shortcoming happening due to lack of wards. So it would be good if we had wards in our facility.
Yeah.
It would be good if we had a morgue in our facility.
But the morgue is definitely something that for the community.
It should be needed because the community treks kilometers away to go to Montezuma, Thika Road, or to go to Githumu, which is not in a good condition. So, in our plan, we had that mock. In our plan, we had works, but we lacked money. As you can see, the rooftop is shattered, meaning it could be a continuation of a storage hospital, but due to lack of finances, we just put iron sheet on the top.
And I see you've got a lab.
Yeah, we got a lab, but the lab doesn't have enough facility.
Yeah.
We only have a centrifuge. We do stool culture and urine culture, pregnancy test, H. pylori, tuberculosis we don't do because we don't have an advanced laboratory.
Yeah.
As you can see, our microscope is way too old. So what we don't do full hemograms.
Yeah.
We don't do LFTs, which is liver function tests. We don't do UECs for the kidneys, and these are the things that we need in the facility. I think even though we had the dialysis machines, our staff capable of doing everything, I think I'm equal to the task. The doctors in the Hopkins hospital.
Oh wow.
Yeah.
No, that's
because we can work everywhere, but due to limit, we use what we have, and that's not a good thing.
I think it's one of the things here at Africa Healing Foundation is we want to make healthcare accessible, high quality healthcare. We believe that it's a human right and everyone deserves to have access to healthcare. And I just kind of want to hear from you, what has inspired you to get into healthcare?
As for me, I like giving back to the society because I was brought up in a very poor background. I've done legal and medicine.
Wow.
I can stand as a lawyer for you, and I'm also a doctor. But my passion is medicine. Medicine has really inspired me because I was born back then, and 6 months after my parents died, both of them in an accident. And I thought maybe if there was a close proximity to a dispensary like this one, my parents would be surviving today. I'm a survivor of that accident. So, and the doctors worked on me. As you can see, I have something here. This is a mark. The marks, the beauty marks that makes us proud of who we are today. Number two, my grandmother died of hypertension. The grandmother who brought me up. And that really hit me because I didn't know what to do. I was just a toddler, class 6 boy, and that really inspired me. My dreams were becoming a lawyer. Actually, I schooled at African Leadership University.
Really?
In Mauritius.
Oh wow.
Internship, I was in Netherlands.
Wow, but you came back.
I came back to give back to the Kenyans. So, after losing my grandmother, that really inspired me becoming a doctor. And what I love most is assisting the aged in the community. I even go door to door in this community, and I treat them from there, free blood pressure monitoring. I go to churches every Sunday, different churches, not only the Presbyterian church, but we go in the name of PCEA Women's Guild Dispensary, started by Priscilla Mereka. That woman really touches my heart.
Yeah, I'm named after her, so I think I feel like there's something I'm here to finish.
Okay, the facility is good. for instance, last week I lost my cousin. She was called Abigail. You could see her on the Citizen television.
Yeah.
She's just 15 years old. Form 2 at Kawia Girls. But unfortunately, my cousin died because there wasn't a close hospital near their area. So the distance from Kawia to Muranga Hospital, on arrival she was confirmed dead. But we have Narrow High School near us. Even though they get sick or ill at the midnight, I just I can even walk and run to come and save that person, save that life. So I think the dispensary or the hospital, let's call it a hospital.
It's a hospital.
We do things that are done even in Kenyatta National Hospital, in big hospitals. So this hospital has really assisted the community, and the community is very happy. As you can see, we have patients here, and they can tell you they came in pain and now they are going home relieved.
That's really good. And you've got
that one is called Elder Wanjiko or Mama Njioki.
Yeah.
Njioki is a doctor at Kigumo Level 5 Hospital. But she was referred here by the son because the services are really good. She came in pain, but now she's going home smiling. And my motto in this hospital, I do tell them in my Kikuyu language, this is Jordan, and because you've come into River Jordan, just dip yourself, you go home healed. So this hospital is a Jordan that Priscilla and Domereka left a legacy, and we are really happy that woman, even though she's rested, we can still remember that one of the things she really did and was good is supporting the Women's Guild. She was the first Women's Guild chairlady in this parish, Kandara parish at Raj, and that's why in commemoration of her, they left a legacy of building this facility. But you could assist, so you can see. All these runs is for building the hospital, extension of the hospital, but we don't have have finance, or we are helpless at the moment.
I think I really relate to a lot of what you said because, like with my dad, the same thing. It was the reason, like the passion for me, healthcare, is, for me, it was more negligence. And I feel that's something that is lacking. There's a lack of, especially for places where there's affordability, there's negligence. So it's really important for me, healthcare is something that not just providing high quality healthcare, but actually doing it from the heart, like what you're doing. Because you could have had so many opportunities to go anywhere, but you chose to be here.
For example, I've got invitations from Germany, from USA, but I think this is not the time. This is the time for me to assist the community. The community was grieving. The women were crying. We need our Mwangi back. We need our doctor back. Because it is passion. It's passion that really takes me, or that has made me. I don't know. I'm so pitiful. I don't like.
It's called empathy. You have empathy, but that's what makes you. It makes you human, but it also makes you the right person for the job because it's about passion and impact in your community. Well, thank you so much for spending the time with me. And guys, please, if you're watching this video and something has connected, do help us to raise funds so that we can expand this hospital and we can get the necessary equipment so that people can benefit from it, the community can benefit from it. So I am appealing to you to donate towards this facility, and we will keep you updated in regards to the expansion and how much we're able to do together. Thank you so much, Dr. Kimani.
Mwangi.
Mwangi. Thank you so much, Dr. Mwangi.